going to talk about root canal treatment 101. Really, what are the basics? Now, I'm going to start and I'm going to get this out because, there's going to be some people going, oh, you're a holistic dentist. Holistic dentists don't do root canal. They, blah, blah, blah. Root canal's about all these things that you may and may not have heard. Now, are root canals our friend or foe? Now, I'm going to share a little bit about this because one of the most contentious and debated topics in holistic dentistry is root canal. Should we do them? Should we not do them? If you've got one, should you keep it or should you have them out? Well, I base my treatment recommendations on your individual needs and your wishes, and the same applies when we're considering a root canal treatment and the option of it. Now, root canal treatment is poorly understood by people outside of dentistry, and so today I'm going to go through some of those basics for you. But let me bring up just very briefly what the concerns are. Now, essentially you need root canal treatment when your tooth becomes diseased or infected or has had a trauma that has caused an impact to the nerve and has damaged it so that the nerve is no longer viable. If we don't do anything, the tooth dies, you end up with an abscess and infection, which is bad for you, it's painful, and it's bad for your health. Your teeth are here, your brain's not that far behind. You can end up with bacterial meningitis from dental abscesses, and people can die from that even in this day and age. So we don't like to leave you with chronic or acute infections. Now, when your tooth dies, when the pulp, which is the nerve and the blood vessels inside the tooth, become diseased, there are two treatment options. Remove the tooth completely and end up with no tooth, and then the implications that can have on the balance of your bite, the balance of your body and your posture. Yes, that does have an impact. Also on your ability to chew, depending where your tooth is, your smile and so forth. And then we have to look at what we're going to do to replace that. Now, if you have a tooth extracted and you don't replace it, the two teeth next door, they've got nothing in between them, and a bit like books in a bookshelf, they'll start to collapse inward. The tooth above or below, because it doesn't have its chewing partner anymore, will start to over-erupt, and that changes your bite, makes it difficult for you to keep your teeth clean, and you can end up with more complications. The other thing is you're also losing one of your chewing partners, and that means that the workload that tooth used to do now has to be spread to the other teeth, and that can put more forces and trauma onto those, causing fractures and breakage, breakdown of dental work that you've had done, and also impact on your jaw joint as well as on the bone support around your teeth. When you don't have a tooth, your bone that used to be around your tooth is no longer stressed and pressured, and that bone dissolves and shrinks away, and your jawbone thins and reduces, and you can get recession around the adjacent teeth. Because of that, if you've lost a lot of teeth, then your face tends to cave in and it can make you look a lot older. So the issues around root canal, I'm going to quickly go over this, are whether we can sterilize the tooth and disinfect it adequately, whether we can clean everything out properly, and whether we can seal that tooth up with the filling material, and whether those materials that we use are actually good for you or not. Now, if you go and do your little search on the internet, you will find all these things about Weston Price research that he did that stated that root canals cause focal infection, and that, if you take the tooth from somebody who's got this infection and you implant it in a rabbit, then they get that disease as well. I don't think that's entirely accurate. His techniques and methodology was very circumspect, and apparently the infection control was not great, so bacteria could have been coming from anywhere outside of that tooth. But there is some merit in what he was saying, is if we leave infection, what impact does that have on you? Can we clean that tooth out entirely? No, we can't, because the tooth is made up of lots of little microtubes. You've got the main canals and then all these little tunnels going off, and the theory is that we leave bacteria behind, and then that has a problem because you've got these pathogens going on all the time. But The reality is we clean out the main disease tissue. We use disinfecting and sterilizing agents. We put what we call biochemical and biomechanical products in there that are pH 14, super alkaline, and that spreads through the tubules within the tooth and even out into the bone, so you can measure that the pH is 14 outside the tooth, and that kills off bacteria because they don't like that. They don't like that environment. And then we use bioceramic sealers that also can penetrate into the tooth and release that pH 14 for a long, long time after the procedure is completed. And there's been studies recently that show that the microbiome around a well-treated root canal tooth is actually protective and looking after you and your tooth, as well as your immune system doing its job. So, I've spent 3 decades agonizing about should we or shouldn't we do root canal. And because the techniques and the materials are so well advanced now compared to what I did when I was training, I do root canals for my patients, but we have a big discussion. Now, your alternative is usually an implant. So people go, oh, I have the tooth out, then I haven't got any infection, I haven't got to worry about anything, I'll have an implant instead. Well, around your tooth, between your tooth and your jawbone, is a natural ligament called the periodontal ligament. Now, that acts as a little cushion and shock absorber for the tooth, but it is also a protective barrier which prevents bacteria that sit around your tooth from migrating down between the tooth and the jawbone. When you have an implant, that periodontal ligament is gone, and then the bone sits around the implant, and you have a gap where bacteria can penetrate, and you end up with implantitis, which is a chronic inflammatory disease of the gum and the bone around the implant, which 90% of people with implants have. And then I'm like weighing it up. Do we have bacterial leftover from root canal treatment, or do we have these bacteria from the implant? And then what impact does having a big piece of metal screwed into your jawbone have? I think that the pros and cons pretty much even each other out. Ideally, we'd like you to keep your own tooth, and the younger you are, the more we encourage you to keep your own tooth, because implants come with complications, and if they fail, then you usually end up not being able to put anything in its place. So if we can keep your tooth for as long as possible, if and when your tooth fails, we now still have the option of putting an implant in. Or we have to try and anchor something off your existing teeth, which means we've got to drill away tooth structure. We're going to damage your other teeth, put more load on them, and we can have this domino effect. So that's a very, very quick synopsis of, the concerns about root canal. I have done a podcast on this, so you can go and find that. And I've also got a blog on evolvedental.com.au if you'd like to have a read of that. So I'm going to go back to the original premise of this podcast today. What we're here in the Dental Zone to talk about is I was going to educate you about what is a root canal, how's it done, and what to expect. Because you mention the words root canal to people, and you might as well say, I'm going to behead you. You're going to be hung, drawn and quartered, boiled in hot oil, because they're freaking out because they've heard all these horror stories about, root canal's really bad, it's really painful, it's a horrible procedure. Actually, it's not. If we can treat your tooth, reduce the infection, we can work on that tooth in a relatively comfortable and, in the most cases, pain-free way. It's no worse than getting a filling. You're numb, you can't feel anything. It's just a lot of fiddling around. It's quite a long-winded procedure. It's very technical, so it takes time. So a root canal treatment is also called endodontics, which is just the Latin fancy term for whatever we're doing inside your tooth. This is required when the blood or the nerve supply of the tooth, known as the pulp, becomes infected because of decay or injury, as I've said earlier. You may not feel any pain in the early stages of the infection. In some cases, your tooth just starts to look darker, which means that the nerve is dead, died, or dying. Root canal treatment, we provide it to help prevent you experiencing pain and having infections, rather than removing the tooth, which is the only other option when your tooth dies, because we do not encourage you to walk around with a dead, untreated tooth, because that is far more problematic to your health and well-being than either a root canal or an implant would be. If the pulp, the nerve, becomes infected, the infection may spread through the whole tooth system, through the root canal system in the tooth, and this eventually can lead to an abscess. An abscess is an inflamed area where pus collects, and that can cause swelling in the tissues around the tooth. It can be very painful. It can also be very serious and put you in hospital, and as I said, it can impact quite severely. People can die of dental abscesses. The symptoms of a dental abscess can range from a dull ache to severe pain, usually throbbing in nature. The tooth may be tender when you bite. You can't actually chew on it. It may be tender when you touch it. And if a root canal is not carried out, the infection will spread and the tooth will need to be taken out. Does getting a root canal hurt? It shouldn't. That is my answer. But there are times when your tooth is so infected and inflamed and painful, it can be difficult to get numb. And in that case, we quickly open the tooth and, we numb it best we can, quickly open the tooth and put a sedative medication in and let your tooth calm down before we come back and start the root canal treatment. So it shouldn't hurt. Usually we do it with a local anesthetic. I always do. I always numb. And you should feel no different to having an ordinary filling done. You're going to get some tenderness afterwards. That's quite common, and that gradually gets better over time. And sometimes it hurts a little bit more, which I know you don't want to hear that, but it's actually a good thing. It means you've gone from chronic inflammation and infection to acute inflammation, which is the type of inflammation that actually helps your body to heal. So that's okay. So we're always going to tell you, take some painkillers, we may give you some antibiotics. I try not to. Normally pain relief on its own is enough. Now the aim of a root canal treatment is to remove all the infection from the root canal systems. The insides of the root is cleaned and filled to prevent further infection. So you've got your root, and inside that there's a little tube or pipe where the nerves and the blood vessel supply. So you're not having your root removed. You still have the roots on your teeth in the bone. We're cleaning out the soft stuff that sits in the middle of the root. So like in the hole in the middle, we clean that out and then we fill that up for you. Root canal treatment is a skilled and time-consuming procedure, and the course of treatment usually involves 2, sometimes 3 visits to the dentist to be able to clean, shape, measure, disinfect, medicate, get the infection under control, and then another visit to check that that's all worked before we actually place the filling up inside the tooth. So at the first appointment, the infected pulp, the nerve and the blood tissue, are removed, and an abscess, if there is one, will be drained. The root canal is cleaned and shaped for the filling. A medication and a temporary filling is put in the tooth, and the tooth is let to settle, and we make sure that the infection is under control and healed before we do the next part. The tooth is checked at a later visit, normally about a month afterwards, and if all the infection is cleared, then the tooth is permanently filled. Occasionally, a root-filled tooth can end up darker after treatment. However, with modern techniques and modern medicaments, this does not usually happen. If there is any discoloration, there are several treatments that are available to be able to restore the natural appearance. So we can do specific internal whitening for that tooth. Often we'll put a crown on that tooth because, teeth are just weaker because they've had big decay or trauma and injury, and when you've had a root canal, the tooth can be a little bit more brittle, so a crown is put on to help reduce the risk of the tooth from fracturing or splitting. Root canals are usually very successful. There's about a 95% success rate if the case is chosen carefully. However, sometimes infection can come back, and if that does happen, then the treatment can sometimes be repeated. We often find now with 3D imaging and better techniques and materials that we don't get so many issues with reinfection. If the infection doesn't go, it's usually because there's a micro fracture down the root and the tooth is no longer sealed, it can't be fixed, and unfortunately bacteria get in. And if that's the case, then the only other option for that instance is to have the tooth removed, despite everybody's best efforts. So why should you get a root canal? Well, the alternative is to have your tooth out. Once the pulp, the nerve, is destroyed, it cannot heal. It's got a very limited blood supply, and it is not recommended to leave an infected tooth in your mouth because of the risk of abscess, because of the risk of that spreading to your brain, causing problems elsewhere in your body, also pain and nasties going on. It's usually best to keep as many of your natural teeth as possible, but as I said earlier, each case must be based on the condition of the tooth. Like, is there enough tooth left that's worth saving? Will it be strong enough after treatment? What's the health of my patient like, and what are your wishes? So sometimes people come in and they're just adamant. It doesn't matter what we say, what we share with them, all the information and things that we can put out there to help with their understanding. They've just made their mind up, they're not having it, and they're going to have the tooth out. I'm not going to argue with that. It's their tooth, their body. They have to deal with the consequences. As long as I've explained everything to them and they understand that, what those consequences are, then by all means we'll get the tooth out. If I've got patients who've got poor, like really poor health, they've got a lot of autoimmune conditions or chemical sensitivities, weak immune system, then a root canal may not be the best course of action for them. But again, we discuss that, we work together as a team, and we go on what they decide. So if they want to try and keep it, then I'll do that for them. If they say, I'd rather it goes, then again, we'll get the tooth taken out. So a dead tooth is often more brittle, and it's often necessary to restore that tooth with a crown, or what you call a cap in layman's terms, made out of porcelain that goes all the way over like a little crash helmet, to provide extra support and strength for the tooth. Now, root canal treatment is a routine dental procedure, and most general dentists, I'm a general dentist, but I'm also holistic, our training allows us to do root canal, and we'll be very happy to do them for you. Sometimes though, we might have to refer you to a root canal specialist called an endodontist if your tooth is more complex. Sometimes roots can be very curvy and tortuous. You can have additional canals that are hard to get to. Sometimes the canals can have little calcium plugs and things in them which we can't navigate, and therefore we need the specialist to take care and help with us and you with that. So once your root canal, once your root treated tooth is done, you just treat it the same as any other tooth. Your periodontal ligament still lets you know that you're biting and chewing on there. You won't feel hot and cold because the tooth doesn't have a nerve to signal hot and cold, but you can certainly, like if you push or press on the tooth, you still get that same sensation. Remember to keep your teeth clean, brush for 2 minutes, twice a day, 3 times a day if you can. Don't have too much sugary foods and drinks, and see your dentist and get that checked regularly. What I do like to do with my patients who've got root canal teeth is we x-ray those at regular intervals just to check around the ends of the roots to make sure there's no signs of infections or disease or problems. Occasionally your body will reject the tooth. That happens in very low percentage of cases, and we just need to keep an eye on things to make sure everything's normal under the surface there for you. So I hope you found that informative. I hope you found that helpful, and it's opened your eyes to the world of root canal and what they are, how they're done, what to expect. Please, if you want to know more, you can check out my other videos and podcasts. But for now, I'm Dr. Rachel Hall. This is the Dental Zone podcast. If you would like to have an appointment with me, if you're in the Brisbane area or you want to travel, 0737201811 is the number, or you can use our contact area on our website, evolvedental.com.au. Thank you so much for joining me, and until next time, stay in the zone.